Hi everyone, welcome back to KG and Associates, Straight Talk for Mental Health. This is Janice D'Souza, Associate Therapist, and I'm here with Karen Goslin. How are you today, Karen?
I'm good, Janice. This is funny, right? We're flipping roles here today.
Yeah, we definitely are. Yeah, I hope you've been having a good week and things have been going great for you.
It's a busy week. I know, like what I said to you just a couple of minutes ago, I keep writing January on all of my notes. I don't know where even that's coming from, but I think it's still, I guess it's hard for me to believe that we're already in February. And I know a lot of other people are feeling that way as well. People are still citing that it's our COVID memory. I don't know what you think about that, but everybody is still referring, or a lot of people are referring to this idea that we lost our ability to measure time when due to the pandemic. So I don't know if that's it, but I literally had to keep writing January, cross it off, and then write February all week.
Yeah, no, same. Sometimes I forget. Like, I just feel like another year is gonna go by so quickly.
I know every day's a gift.
Yeah, great. So for our listeners out there, last week we did have a special guest on our podcast. Her name was Marlene. And we had a great conversation. She talked about, trends in divorce, her role as a lawyer for divorcing clients, and the impact that divorces have on families, especially children, and parents, of course, as well. So, Karen, I wanted to start off just by asking you what you thought about our conversation with Marlene last week and anything that came up for you.
Yeah, I loved that conversation with Marlene. I mean, I think I said to the listeners, her and I, joined on an agency some years ago, and I just stayed connected with her. And I thought she did her homework for that podcast. Like I felt she had all these case laws, and I've actually referenced this with clients this week. My conversation with clients this week changed because of that podcast,
Mhm.
and I found myself feeling more optimistic. I thought it was great that she could identify how the legal system is trying to evolve into a better place for even, for example, to help the payers be more accountable, and really going after when there's that imbalance or unfairness. And I thought she was so prepared, and I didn't expect anything less from her. I trust her with all of my clients, and who need some legal advice or consultation. I thought she was really prepared, and for me, professionally, it helped me feel more optimistic because I work with clients who are in the trenches of this, and the time and the money and the energy that goes into it. And if, I'm not sitting here going, I think it's all perfect, but I thought it was encouraging to hear what she had to say about how the courts are trying to do a better job. And I think
Yeah.
that's important.
Yeah, no, absolutely. I think she came in with great energy and great information. Like, I remember while she was talking too, there was so much that I was learning as she was like pointing out the trends and just how family court is really picking up things and serving families better, really.
Yeah, and
Uh,
using that term gatekeeper, like
yes,
obviously that
yes,
wasn't a new term to me, but how it was getting used in family law,
yes.
I liked that's how it's getting identified. Yeah.
Yes, and then even making those connections to our work, and how, divorce does affect children and what can we do better in our roles as well. Um, so yeah, I did want to like, from the perspective of the work that we do really when divorces happen, why do you think it's important in our work that we treat families who are either in process of divorce or who have been through a divorce?
Yeah, this has been a big passion of mine. So there's like, to me, there's like a community reason and there's a personal reason for me. So I mean, I in preparation for today, I did my homework. And I jumped on the, Stats Canada site the other day because I was like, what is really, what are our current numbers? So what I read was that in 2022 in Canada, there were 62,000 divorces,
Wow.
right? Nationwide. The rate is 36%, right? Which actually was lower than I thought it was, but anyway, that's what it said. Here's the interesting stat, and I knew a little bit about this, but that on average, the couples that are divorcing have been married on average for 15 years. And I remember hearing this some years ago because the new term was called gray divorce. So my first answer to why we're helping these families is the sheer numbers and the sheer need in our community of what is happening and how this
Yeah.
is tearing couples and families apart. And, you know, I think I've said this more than a couple of times, that I know the psychiatric community, for what it's worth, has designated divorce as the second most stressful life event, only preceded by death of a child.
Mhm.
And so we know that, first of all, the numbers are high, and number two, the mental health issues are high. So how can we as social workers not attend to this in the work that we do?
Yes.
And I'll go into this in a bit more, but because we see families at any stage, couples that are trying to save their marriage so they don't divorce, you
Mhm.
know, individuals and parents who are in the midst of the divorce, and then the aftermath. So at any of those three stages. On a personal level, why am I so passionate about this? And I will, when the time is right, share this with client. But I went through a divorce, 21 years ago.
Mhm.
Um, and and it was like the hardest time of my life ever. And I learned so much. I learned so much. Sometimes as social workers, we're like, are we supposed to hide the fact that we had problems? And as our world is evolving, I think our own experiences are just having a clearer place in the work that we do. So when it's right, I do share some of my own experiences to normalize how hard it is, but also, to help educate on what is helpful. And I know for sure one thing that almost everybody going through a divorce benefits from doing is figuring out what the heck happened and what was my contribution to it. And because I've done my own work on that, not and it's always evolving. I don't have it all figured out. We're still growing and learning. But it's so powerful for me to have figured that out, and to dedicate some of my own personal journey to making my life and my relationships healthier. It just means more, right? It just
Mhm.
means more to me with the clients that I meet. So high numbers, high mental health, and for me, passionate about helping people through it, knowing what I went through myself.
Yeah, and just given your experience and when you do work with, say, for example, couples who are thinking about whether they should get a divorce or not, how do you help those specific couples? What is like some key points that you've noticed when you work with those couples specifically?
Yeah, that's a good question. So, our assessment with couples coming in who are on the brink of
Mhm.
separation, it's like the stakes are so high
Yes.
for themselves, for each other, and if there's children, yeah, three huge stakes there. So I take it very seriously, and this is why I want KG and Associates, why I want our team to have such sharp assessment tools,
Yes.
because we have to figure out and be able to give that information to the clients about the state of their relationship and how they got there and what they need to do differently. I can probably count on two hands in the years I've been doing this when I completed a couple assessment with a couple coming in to separate, where I agreed that they should separate.
Mhm.
And
Mhm.
what I said to a client earlier this week, 99% of the divorces are unnecessary. And people usually like to hear that, because 99%, this is my opinion, that couples break down for all the wrong reasons. They've come together, there's a clash that's real, and mismanaging that clash can easily lead to either a parallel relationship where we're just friends, where we're having affairs because we can't get our needs met in the relationship, we choose to cheat to cope, or we separate. And it's at that intersection that gets so easily mismanaged.
Yeah.
So for me, the assessment has to be comprehensive, because if we as the clinicians don't understand what's happening or why, how can we be helpful? And as you know, I like to be really direct, because it's like people need to know what they're doing. So most of the time, when I complete that piece of work for clients, they can understand
Mhm,
why they felt like separating and why that might not be their solution.
mhm.
Because we will go through all that upheaval and come back to another broken relationship.
Yes.
People feel relieved. For the most part, people feel relieved that there's an explanation
Mhm.
that makes sense to them, and then what they can do in order to work on their relationship rather than separating. And I would say a majority of the couples I work with that come to me in that stage, they get that work done and they move
Right.
on to a healthier relationship. And people will say, well, I want to get back to how it was. And I'm like, no, you don't. No,
Yeah.
you don't. You do not want to go back to the way it was. Yes, there was a honeymoon period.
Yes.
Yes, there was a time when it felt better, but that was part of the honeymoon that got you into that conflict stage. What we're trying to build together is a more intimate,
Mhm.
vulnerable, healthy relationship, um, that was better and is more substantial than the honeymoon phase, right? It's deeper. So I'm passionate about that. And I always think of the children or teens that I never meet,
Mhm.
because if I can be part of a healing process for this set of parents, then I know the children will benefit. Because the motto that I was taught years ago, and some of the listeners might agree with this, some might disagree. Sometimes it's a good debate to have, but it's better for children to be from a broken home than in one. So if we do all that grunt work and it doesn't work out, then yes, we are working towards separation and divorce.
Yeah, and it's really interesting that you brought up that point because I have these conversations as well with other people, and you're right, that is a very debatable statement, but I have to agree. Like I've always been a strong, I've always agreed with the fact that if children are going to be raised in a toxic environment or
Yeah,
looking at their parents having this, for example, an abusive relationship or just a bad relationship, it's a lot better for them to be removed from that environment and heal than constantly be stuck in it just for the sake of having two parents.
right.
So it's a really good point, and I think a lot more people are becoming aware of this as well, of that difference. Like it's not just enough to have both parents or have their parents together if it's not a healthy relationship.
Right, exactly. And you raised a good point, because let's be clear. If there's abuse, if there's addiction, if there is serious mental health,
Hmm.
right, then yes, we will be helping the
Yes,
victim in that relationship be safe and the children safe.
children.
And we know clearly that, an instant reaction needs to be in
Hmm.
place to achieve safety. But however it happens in our practice, the majority of the clients that are coming in, to have those softer issues of
Right.
conflict, that they could be divorcing for the wrong reasons. Yeah.
Yes, yeah, for sure. And something I noticed a lot of work we do in social work with families and, the connection to our external factors. So we do use like that systemic approach. I just wanted to know, like, what do you feel about the systemic treatment and why do we offer
Yeah. So here's why I hired you, Janice.
that?
It's like, why am I working for you, Karen? This is why you're working with us. My training years ago, so before I opened my private practice, I worked in a government agency for sexual abuse. And the whole approach at that time was a systemic team approach. And it was brilliant,
Mhm,
because literally we could do a full assessment with these families and then divide up the work. And it gave members of the family options to work with different therapists, where one
mhm.
core therapist then worked with the entire family. So I hired you because we were so busy, and I wanted to make sure we were serving the community. And then what has evolved, right, which we need to really publish more about, is this idea that allowed us to do the systemic treatment. So we
Mhm.
have several families now, right, where I'm doing the family
Yes.
work and you're working with one of the children or teenagers or young adults. And this is bringing back all my memories. Oh my God, it's like right back into the 90s again of working in the systemic approach. So with divorcing families, this can be really helpful
Mhm.
because it's so painful. what different members are going through. There's loyalty binds, there's divisions, there's boundary issues, there's grief. And so the systemic approach that we offer allows us to integrate the treatment between therapists while at the same time giving children or teens the ability to work with a separate therapist. There are some things that they can't talk to their parents about yet. They've lost trust, or they have
Yes.
felt betrayed. They're caught in the middle, right? Triangulation, right? Children and teens get stuck in between their parents' relationships. It starts to have a profound effect on their development, right? Their brains are developing in the midst of their parents' divorce. So the impact on them is more severe. So we take that seriously, and we like the ability to offer a multi-team approach so that if we need to, we can separate out the work and then reintegrate it when it makes sense for that family. What I'm doing more of in the middle phase, so in that second stage where we're helping families actually who have concluded that they need to separate
Hmm.
and divorce, this is a trend that is happening in my work just in the last like 9 months, I would say. So families and sorry, parents who are couples who are deciding that despite the work, that the divorce is still the right decision. Parents and couples are staying in the therapeutic process longer, and they're staying in to figure out how to co-parent, how to ground their grief, how to emotionally separate um towards a better future. And it's not that that work was never offered, but more people are taking it up, to do. And I'm excited for that work, because obviously how we separate, if we can't save the relationship, but we can work through a healthy separation, everybody wins, right? Everybody
Yeah.
wins. So the level of consciousness that people are having about how to have a good separation seems to be on the rise. And I'm excited for us in the work that we do, that we can help families through that process, even if we can't save the marriage. So that's an interesting trend that I'm seeing. I
Yeah,
think
no, that really is a good point to bring up. Have you noticed, like, so those are trends with the parents. Have you noticed common things that come up for children or teens that you work with of divorcing couples? Like any common trends there with like how are children affected by the divorce, or what do they bring into sessions with you specifically?
Yeah, it is really tough out there. It is really tough. I work with children and teens as well. And I see that the longer that process takes,
Mhm.
what I find in the work is that there is oftentimes a prolonged period of crisis management in our sessions, where the grief is kind of like so far on, like so much on the surface, that the sessions are best used just to manage the high intense emotions as those children are stuck between the parents. Parents are stuck trying to figure out how to separate. And so a lot of the trends in our work with the children are about, oftentimes there's a prolonged crisis management of debriefing of how hard it is.
Mhm.
I'm always helping, trying to look for those moments where children can feel some sense of power and control and choice, even in these situations where there's a lot of like situations that are happening beyond their choice.
Right.
But, and, this is why I was curious to hear what Marlene had to say, because if it's going to happen, if it's beyond the point of no return, then then we have to figure out how we're going to survive that process. So I would say one trend is if that process is long, then our role in our work changes. What about you? I mean, you're working more with the children of divorce. What are you seeing?
Yeah, it's very similar, but a lot of pieces I see with children and teens is, and I briefly talked about this with the podcast with Marlene as well, but they want someone who they can openly speak with, someone who they can just express how they're feeling, especially when they're caught in between two divorcing parents.
Yeah. Yeah.
Um, they don't want to be caught in the middle of that anymore. They don't want to, like, they can't go to one parent without the other parent hearing about it or feeling defensive about it. But when they do the work that they do with us, it's almost like it's just between us and them, and they have this trusted relationship where they can explain and express everything that's going on for them.
Yeah.
So yeah, I do see that it's a healthy outlet for a lot of children and teens that come in, and
Yeah.
they're always very open to just, sharing and
Yeah.
getting some
Yeah.
tools and strategies that they can use to even manage some of those stressors, because it's
Yeah.
not easy for sure.
Definitely, because one of the biggest mistakes separating parents do, is if their great grief isn't grounded, they will try to pull one child onto their side,
Mhm.
whether they're conscious of it or not, right? And whether it's bad mouthing, but it's about, and this is how hard it can get, right? And they're, whatever they're upset about with their ex-partner, and they haven't made sense of yet, the grief is just free floating and totally holding the family hostage. And then that hooks the children in, usually one way or another. And that's why we start to see some of the acting out to try to unify the
Mhm.
parents. All kinds of unconscious mechanisms start to
Yes.
play out. And obviously, that's the first one I see is acting out teens in an unconscious way to unify their separating parents, because although it may be healthier for the family in the end for the parents to separate, it is devastating for the children. So we can, they start to show up in all of those acting out behaviors that, is an opportunity to unify the parents, but we can get caught up in the smoke. Yeah, it's complicated. It's so complicated.
Do you ever notice adults who were children and teens when their parents were divorced look at relationships differently or go into relationships differently when they're adults?
Yeah, for sure. I mean, this is, as I said, if your brain is developing during this family crisis, and every story is unique. Like we can
Mhm.
talk about the trends, we can talk about the themes, but literally every story
Yes.
has its unique combination. And that's on us to figure out what that is. But for the most part, from a developmental perspective, whatever the age of the child was during the divorce, whatever that unique story for that family's
Mhm.
divorce was, we have to figure out what developmentally was ruptured.
Yeah.
Was it trust? Was it control? Was
Mhm.
it self-worth? Was it identity, right? Those are the four stages we need to go through to master so that when we are an adult, we can create and maintain intimacy.
Yeah.
And divorce can easily disrupt any of those four or a combination. So the trend I will see, usually there is that control wound,
Mhm.
right? Because the amount of control and choice that they have over what's happening with their parents is limited. Whether they were given too much control to take care of one of the parents, or whether they had no control and everything, the rug was just pulled out. And so we will see control wounded adults, if that's a
Mhm.
term, right? Where they will be over under controlling in their life. And that can include
Yeah.
like so many things. But it can also be about trust. People who trust too easily. I think a common theme is where adults don't trust enough. They don't trust themselves,
Mhm.
and they don't trust in their dating world.
Yeah. Yeah.
Most of the time, what I will see is adults over controlling their vulnerability, where they're not out there at all trying to date, or if they are sabotaging their dating. They're fearful of
Mhm.
being, I don't want to be divorced like my parents.
Right.
That's a common one. So it plays out in the intimacy of the adult's life, where trust and control, I would say, were probably the most common ones. And so then they're sabotaging their relationships, usually by over controlling vulnerability that sabotages their relationship. So they're not in the game, but then they're depressed because they're not in the game, but they don't know how
Yeah.
to get into the game. So working through their grief of their own parents' divorce and what that meant to them, is key because we end up, it's that self-fulfilling prophecy. I don't want to become a stat. I become a stat because I was so afraid of becoming a
Right.
stat.
Yeah.
Yeah.
Yeah. And we could talk about this forever because there's just so many good points that you bring up. Like you're right with the lack of trust, the control wound, and that's seen at the heart of the work we do with our clients. So, thank you for sharing that. It
For
was really,
sure.
yeah.
Yeah.
Um, yeah, and I know you did briefly, speak on your personal experience. So if we did have to leave our listeners with a few points, what would you share about, for example, like what supports did you get back then that helped you get through divorce? Or what would you have liked to have done differently or get supported in what ways?
Yeah, that's the $1,000,000 question. I think I was one of those stats where
Mm,
I was part of that 99% where it was preventable. And that's the tragedy of divorce, right?
mhm,
And when I help people who come to me after the divorce or the separation is finalized, this is part of how grief gets awakened because we understand that it was preventable. And it was a complete nightmare for me. My daughter was about 3 years old. I was raised in a Catholic family. There was hard, I don't think there was one divorce in my family. It wasn't even on my radar. It wasn't even on
right.
my radar that it would happen. And by the time my husband decided to leave, it was too late for him. And so this is how I explain it to my daughter. Maybe this will help our listeners because I had to figure out how was I going to think about it myself and
Mhm,
how could that help me help her. So I said to her, I stopped listening and your dad stopped talking.
mm,
And we still talk, her and I still talk about that. But that is what is important for these 99% of the people that are preventable divorcing. Um, because the dynamic between him and I was we kept, as with most couples, we will perpetuate an unhealthy dynamic. And the more he didn't talk, the less I listened, and the less I listened, the less he talked.
mm,
So that was our unique pattern. And everybody has one version of their pattern. And so, um, that is why I'm so passionate about helping the couples we work with figure out what that is. Because I know if we can figure out what that is, then we know what the invitation is to grow as a couple, but do all the unfinished work of our childhood, right?
mhm,
So, um, what I know helped me because, and I was in that crisis stage for many years. So I did use a therapist to tell my story, to kind of shed all of the pain and misery I was feeling. And for me, it was like lost control. So, but once I realized where this was all coming from and what the invitations were that were missed for me, to tolerate my frustrations without without fighting so hard, where I could find that quiet place to listen more, and where that came from and how I was going to do that. If I couldn't do it to save the marriage, because by that point it was too late for him, I had to do a better job with my friends, with my family, with my new
yeah,
partners. And that's been like years of evolution, years. And I still have to work on it. Like I still have to work on biting my tongue
mhm,
and not being such a control freak and tolerating what I can't control and figuring out how to kind of just sit with things and listen more. And I'm always learning it. I'm always learning it. But I know that that's where the power came for me in moving on in my life. And this is why it's so important in the work we do, because if we can't turn back time, and for most of us, if we could think of all the things we would do differently, but it is that saying of like, what doesn't kill us make us stronger.
yeah,
Yeah,
yeah.
we should have that coming out in the background right now.
Yeah.
But it's so true. It's so true. And I have this powerful life example of that.
Yeah.
And I just dedicate to that every day. And I think that helps the work that I do. And so then I'm able to have such deep empathy for people because I know it firsthand what that nightmare is like, and I know what got me out of it. And it's not like my story has to be their story, but there is a shared human experience, I think, when people go through that nightmare and how we dig ourselves out. And so I always say, I'm living proof. I'm living proof of life after divorce, because I have built a very fulfilling life. So it gives people hope while at the same time kind of getting them through the trenches. So, yeah, that's what I want to say about that. There's probably, again, we could talk forever, but I think that that captures it.
Yeah, no, for sure. So yeah, for our listeners, like whether you listen to our podcast with Marlene last week, you can understand more of the legal issues or the help that you can get from law or lawyers on that aspect. And if you're listening into this podcast today, you got to hear Karen really share her personal experiences and takeaways. And, hopefully to our listeners who either are working through divorces or who have experienced divorces, or even to our young teenagers and young adults, if you are listening, there is that piece of change and acknowledging that, yes, whether you're deciding to stay in a relationship, we need to break from those negative patterns and repeated patterns to make those positive changes. And if you're going through a divorce, there's also ways to reach out for support and get that help, whether that's from social workers or other mental health professionals.
Yep, you got it. You got it. Crisis is opportunity, right?
Yes.
Crisis translated from Chinese back to English is opportunity. So this is where it goes for sure.
Yeah, so
And
just to
how did it feel interviewing me for flipping the roles? We should do this again.
Yeah, no, it was great because I knew you had a lot to share. I think even when we first met, like you had briefly told me, but I got to learn so much more about that, the personal experience, and it was really nice to hear
Yeah,
and hear that from you.
great. Well, thanks for doing that today. So, any listeners, like you said, children, teens, young adults, couples, at any stage of divorce, whether trying to prevent a divorce, whether they're going through it, or whether they're dealing with the aftermath.
Mhm.
So, we are at KG and Associates. You can reach me at KarenRSW@yahoo.ca. I'm at direct phone number 647-985-0633. And our website is KarenRSW.com. And you want to mention yours in case of the younger listeners.
Yes, for sure. So my email is j6dsouza@gmail.com, and you can reach me at my direct line at 416-316-7686. Thank you.
Great. Thanks, Janice. Have a good day.
You too. Bye, Karen.